I am Dr. Bharat Koyani, MD, pathologist residing in Rajkot, Gujarat, India. Today we will discuss a clinical case of missed chronic lymphocytic leukemia. It was about 1 p.m. I was looking the peripheral blood smear under the microscope, and suddenly a patient rushed into my chamber and complained about my bathroom. I immediately took action, and bathroom was made cleaned and washed. He gave the samples of blood and urine. Report was prepared. At 4:30 p.m., he collected the report in my absence. After 15 days, he again came into my laboratory and entered my chamber. I was afraid that something will happen. I remembered my God with perspiration and said to the God that saved me. Immediately a sound came from my heart, Tathastu. And at the same time, thank you, sir, also entered my ears. When I opened my eyes, the same patient was smiling at me and he told me that thank you very much, sir, and put 6 reports in front of me on my table and said me that, sir, please see these reports. I read the reports. Almost all the reports were same. The total WBC count varied from 15,000 to 17,000. Lymphocyte WBC lymphocyte differential count was about 50 to 55%. I said that there is no discrepancy between these reports. He said that, sir, all the 6 reports, as far as the analysis is concerned, are the same, but 5 reports from other laboratories do not contain the footnote. And in your report, in footnote, you have mentioned that question mark means query chronic lymphocytic leukemia. Now, when I gave report before 15 days, the physician sent the patient to hematologist to higher center where the flow cytometry was done, bone marrow and other examinations were done, and in flow cytometry, the CD19, CD20, CD5 and CD23 were present on lymphocytes, and the diagnosis of chronic lymphocytic leukemia was confirmed by the hematologist. He gave me the history that, sir, I am suffering from rhinitis for the last 1 year. For the first time, I visited physician and he suggested me reports. Every 2 months, I visited physician and the reports were done in various laboratories. The physician suspected due to lymphocytosis, the provisional diagnosis was viral rhinitis. Now here, when I saw the patient for the first time when he entered and complained the bathroom, I looked at him and knew that the age of the patient was more than 50 years. The peripheral smear examination showed that there were many lymphocytes which were mature looking lymphocytic cells and there were smudge cells. Now looking at the absolute lymphocyte count more than 4,000 per cubic millimeter and presence of smudge cells, and the age of the patient was more than 50 years, I suspected and gave the diagnosis of chronic lymphocytic leukemia under question mark and to go to the higher center. Now, before my examination, the 5 reports missed the diagnosis of chronic lymphocytic leukemia. Now, here there is a question how to diagnose a chronic lymphocytic leukemia, which is very simple. When we see the patient above the age of 50 years, and when there is a absolute lymphocyte count of mature looking lymphocytes, and if the smudge cells are present in peripheral blood smear, the diagnosis of chronic lymphocytic leukemia we can put, and this must be confirmed by flow cytometry where the CD19, CD20, CD5 and CD23 must be present on these lymphocytes. Now, why the clinician missed the diagnosis? Because he suspected viral rhinitis due to the lymphocytosis. Because lymphocytosis, whether they were mature looking or not, this was not mentioned in any report. So he missed the diagnosis. Whenever the report comes to the physician and sees the lymphocytosis without mentioning the morphology of the lymphocyte, he should ask for peripheral blood smear examination and do the further things. This is the lesson to the pathologist and physician, that a simple diagnosis of chronic lymphocytic leukemia should not be missed. Now the chronic, so this is a small diagnosis and we should not miss in our laboratory or at the physician level. Thank you very much.